Palliative care is comfort care, and Shawnee Mission Medical Center excels at it. A look at how it makes Shawnee Mission much more than medicine. We've heard breakfast is the most important meal of the day, but what does a good breakfast consist of? Hello everyone, I'm Chris Olson. This is your Shawnee Mission Medical Center update. Love, compassion, and excellent medical care all go into Shawnee Mission Medical Center's excellent palliative care. Focused on the active total care of patients whose symptoms are not well controlled and some who choose not to have further curative care, palliative care isn't hospice, but it puts the patient in the best physical, mental, and spiritual place possible. The word palliative care means to cloak, so palliative services are used to treat the symptoms of a disease or disorder. Examples are pain, shortness of breath, nausea, and anxiety. It doesn't promise to cure, but puts the patient in a better place mentally, spiritually, and physically. And at Shawnee Mission Medical Center, where the patient is the center of attention, that couldn't be more true.
Palliative care can be a support to patients and families who are dealing with complex medical situations and trying to sort out how this all fits together. What does it mean for us in terms of our future, in terms of the care this person's going to need?
The need for having palliative care is so that you have a team that's working with the patient, looking at the whole patient, talking about the whole prognosis, everything that's going on as far as their medical diagnosis, rather than bits and pieces. In many cases, it eliminates some of the fragmentation in their care.
The palliative care team at Shawnee Mission Medical Center is made up of the patient's primary care physician, a physician specially trained in palliative medicine, a nurse specially trained in palliative care, a social worker, a chaplain, and a pharmacist. Together, they apply scientific principles with compassion, continuity, and respect, giving patients and their family peace, knowing they're in the right hands.
The main thing that we stress and think is very important is that we provide good symptom management. And we want to work with the doctors here to help their patients and their families be more comfortable.
The individual patient focus of the palliative team means no cookie-cutter routines or programs. Each patient receives an individualized assessment. Then the custom program is built around them, focusing on the management of pain and other sources of discomfort, emotional and spiritual support for them and their families, a crisis plan, and assistance with advanced health care planning. We've always heard how important breaking that overnight fast is, but a bowl of sugary cereal doesn't cut it for breakfast. This month's Wellness Challenge is focused on breakfast and making it your most important meal of the day. Have you ever looked at the ingredients that go into today's most popular cereals? It's sugar, sugar, and more sugar.
When you're reading nutrition labels, always remember that the ingredients are from higher concentration to lower concentration. So if sugar or syrup, molasses, brown sugar is one of the first couple ingredients, it's going to be a very sweet cereal.
Barb Abel, a registered dietitian, says to focus on a few key components: fiber, fruit, and protein.
When we skip breakfast, we tend to eat more than at the noon meal, or at 10 o'clock in the morning, we're looking for a snack, either at the vending machine or in the break room, where if you ate breakfast, it's just a good investment. The high fiber, the protein. Always remember to incorporate protein in your breakfast too. We'll get you through to that noon meal.
This month's Wellness Challenge focuses on breakfast. Each day there's a different challenge or task and points are awarded. Like on most Thursdays, if you drink a big glass of water, you can get upward to 1,000 points. There are even Saturday splurge days where associates are encouraged to enjoy a good breakfast with family. A quick town hall announcement. February's town hall topic is the rollout of Strategic Plan Mission Excellence. CEO Ken Bacon invites all associates to attend one of the upcoming meetings. All sessions will be in the Shawnee Mission Room with the exception of the meeting in the Prairie Star Conference Room on February 5th. You can count on some light snacks and refreshments. We hope to see you that first full week of February at one of these times. Thanks for joining us for Shawnee Mission Medical Center News, where you can find out what's happening around Shawnee Mission Medical Center. Hope to see you next time. I'm Chris Olson. Have a fantastic week.